So the next we'll be looking at fever in a traveler. Now the background history, you're an FY2 in a GP surgery, a 30-year-old man has presented with a fever. Now, he has had fever for the last 3 days. He returned from Uganda or from Kenya 3 days ago. He was there for 2 weeks. He went only as a tourist to visit. He traveled with his wife. He has had fever and rigors mainly in the evening. During the day is okay. It has not affected his work because in the mornings when he goes to work is fine. They seem to be busy shivering or rigors and temperatures in the evening. He has not measured his temperature, but he has tried to take paracetamol and ibuprofen, but they are not helping. You have to take your history. What history do we need? We need the symptoms of malaria. He's traveling to Africa. There is rigors and shivering specifically in the evening. Does it happen every day? It's crucial for you to ask that, okay? Then ask about the travel history. Ask about the differential diagnosis of a fever in a traveler, okay? Travel vaccination. You need a vaccination before traveling. Okay, the P, maftosa, we complete it. The ice and the effects of symptoms. So let's look at the symptoms of malaria. So you're running temperature. Did you measure the temperature? Ask about the fever. He didn't. Okay, what time do you develop a fever? In the evening. So now you can see here differentiating it from lymphoma, that usually it is at night, tuberculosis, fever and sweating at night, whereas in malaria it's in the evening. So ask about the sweats. He has the sweats, he has got some chills, but in the evening, not at night, which may, of course, differentiate from tuberculosis and lymphoma. He has myalgia, that's muscle pain. He has got a headache. Okay, they may be vomiting, diarrhea, and cough. This particular patient has no diarrhea, no vomiting, no cough, but he has got a headache, he has got myalgia, okay, and of course, he has got these chills, shivering, and fever in the evening, though he did not measure his temperature. But you have to ask for all the symptoms of malaria. One more time, it's a fever, sweats, rigors or chills, muscle pains, headache, vomiting, diarrhea, when you cough. Then you have to take the history of traveling. Where did you travel? When did you travel? And when did you come back? How long did you stay in that country? Did you pass through other countries or not? Or you just went to one country? The purpose of travel. Okay, why did you travel? Was it for business? Was it for work? Or simply, to visit like a tourist? And what activities did you do abroad? Any swimming? Any mountain climbing, any being in the bush? And do you remember being bitten by maybe insects? What about mosquito bites? Did you do any protection against mosquito bite, like maybe buying, mosquito repellent, anything to protect yourself from, maybe some sprays from being bitten with mosquitoes? Okay. Did you take malaria prophylaxis? Did you do all the vaccinations? Okay. Vaccinations before going, including things when it comes to the differentials, things like hepatitis A vaccination, okay, typhoid, yeah. Do you do all the vaccinations needed? Okay. Now, our differentials include the viral hemorrhagic fevers, yeah, like Ebola and the rest of the stuff, yeah. So you need to be asking about any rashes anywhere, any bleeding anywhere. Malaria, we know, it can cause abdominal pain because hemolysis occurs in the spleen and the liver. Ask about jaundice with malaria and together those symptoms, and abdominal pain and jaundice. Tuberculosis, it's a weight loss, it's a cough, it's a sputum, coughing out blood, it's night sweats, it's meeting other people with similar symptoms of cough and whatever. Malaria, you don't get it from others. Malaria, you get it from if you're bitten by what? By a mosquito. So you cannot pass it to somebody else. Yeah, but tuberculosis, that's why you can be asking about contact with others with similar problems. Any diarrhea, vomiting, typhoid, yeah, eating on the streets, eating fruits on the streets, hepatitis, schistosomiasis, swimming in rivers or anywhere. Then we complete the rest of the history as discussed. So your whole history should be the symptoms of malaria, the traveling history and its vaccination, the exact duration they were here, when they went, when they come back, activities abroad, okay, differential diagnosis, traveling vaccinations, maftosa, ice, and effects of symptoms. Okay. Then we do examinations. You need to check your observations. In particular, I want to check the temperature. Examine the chest, that is the lungs, the cardiovascular, the abdominal examination to check for the liver and the spleen. We know malaria causes jaundice because it affects the liver. They may give you examination or normal. Diagnosis, you suspect this could be malaria, but we need more investigations. Now, you're in GP, we need to arrange hospital admission. Malaria is an emergency. It's not tomorrow, it's now. Go to hospital now, explain what will happen. They'll take routine blood testing, they'll perform special blood testing. The thick and the thin blood film, it's a special blood testing that may reveal whether you have got malaria or not. Okay, and once that is done, then they will give you anti-malaria medication. He traveled with his wife. Advise him to inform the wife or anybody else he traveled with. If they develop any symptoms, they need to seek medical help. So they don't need to do anything unless they have developed the symptoms. There is no blind testing. I went in Africa, test me in case I've got malaria. No, if you develop the symptoms, you need to seek medical help immediately. They may offer anti-malaria. For your own information only, the medication that may be used is, of course, artesunate, okay, which is the first line, and quinine. Now, don't tell the patient the names of the medication unless the patient asks, what medication will they treat me with if I've got malaria? Otherwise, this is going to be overloading of information. They will give you anti-malaria medications. That should be enough, unless they're asking for the real medication. Artesunate, okay, is the first line, okay, and the quinine is the next line. Thank you.